This is LiveWell Talk on St. Luke's, the number one hospital in Iowa. I'm Dr. Dustin Arnold, Chief Medical Officer at UnityPoint Health St. Luke's Hospital. St. Luke's was recently recognized as the number one hospital in the state of Iowa for 2025 by Newsweek. Returning the podcast today to discuss this honor and what it means for the hospital and the community is Greene, Market President for UnityPoint Health Cedar Rapids. Casey, welcome back.
Thank you, Dr. Arnold. Good to be here.
So tell us what's this mean?
Yeah, this is a big deal. This is the first time we've been named this honor, number one in the state by Newsweek. I understand this has been around for relatively new, about 7 years. We've made the list every year, but this is our first time in the top spot. So pretty proud of that, obviously. Last year, University of Iowa Hospitals and Clinics was number one. So to knock them out, I think is a big deal for us. Great organization, obviously. But to have us be ranked as number one by an organization such as Newsweek is a pretty big deal, and I'm proud of our team, certainly.
So what qualifies you to win this? I mean, what did we do that attracted their attention?
Good question. There's several awards out there, and many of those are pay to play, where you can pay to participate and pay to be ranked. This is not one of those awards. This is everyone is eligible for this, ranked on various criteria from quality, patient outcomes, patient experience is a big measure here, from large organizations such as CMS, Centers for Medicare and Medicaid Services, American Hospital Association, and HCAHPS, which is an organization that measures patient satisfaction. So large national organizations, they use publicly reported data to rank us and to judge us. So I think that means even more coming from an organization such as Newsweek that's doing this collection of data.
So on a scale of 1 to 10, 10 being the most, 1 being the least, how much did my presence at the hospital contribute to this award?
This was 1 to 10, right?
Yeah, 1 to 10.
Did you get half point increments here? Or?
At least a 5, right?
Yeah.
Okay.
Yeah, at least, yeah. Greater than 2.
What's the reflection on, if I'm just a frontline employee, associate, team member, what's this mean to me?
Yeah, this is a big deal, as I said. I think it's a big deal for our team members, most importantly. This is a direct reflection of our frontline team members, those taking care of the patients, physicians included, taking care of patients, obviously. Everyone should be proud of this because of the components of this award. It's not just quality. It's not just patient outcomes. It's patient satisfaction that has a big play in this. Big on the experience. I'm a big believer in that. That experience that the patient has, that story that they tell, is what means sometimes the most to that patient. Yeah. So point being, every team member contributes to patient experience.
Absolutely.
I don't touch patients on a daily basis, but I absolutely interact with their teams, their families, interact with their themselves as they're traversing our hallways. That interaction, that personal touch that we have, is a big deal, and it's something that all of our team members should be proud of.
I think the patient doesn't know where you went to medical school, where you did your residency. They don't know what sort of doctor you are, despite the internet and Google, et cetera. But they do know how you treated them and how you made them feel and whether they're listened to. Yeah. So that's important stuff.
Yeah. I tell the story with our new hires. I believe quality, making sure that there's no infection, a positive outcome is an expectation of hospital and healthcare organizations. Yeah. The differentiator is, as you said, how they feel, their experience here within our walls. That's the story they're going to tell to their family members, their friends, the community. And that's where we differentiate ourselves, and all of us contribute to that.
Yeah. Yeah, it's no surprise, but how often I know you see them and we hear about them, that patients comment on environmental services cleaning their room and how that person, they name their name, and they how much they made them feel comfortable. And I know when my Aunt Diane was here, she knew all the housekeepers by name because they would talk to her, and it just really contributed to that experience.
My favorite there is, EVS isn't coming in to poke, prod, draw their
No.
blood, wake them up in the middle of the night. They're there to improve the environment and that connection that they make. So, yeah.
What does this mean for the community? What should the community take out of this?
One, we have strong healthcare in Cedar Rapids. We're blessed. Both hospitals in Cedar Rapids, very strong. Last year there were two top 100 hospitals in the state, and both us and Mercy Cedar Rapids were named there. So that's something to be proud of in Cedar Rapids. We're blessed in the corridor to have very strong healthcare. I think what this does for our community, it shows we're good at what we do. We have very high quality outcomes, high patient experience, and you can receive that care and you can expect to have that right here in Cedar Rapids without having to look to other communities to receive that type of care. So I think it's a big shot in the arm for the community. We've known this, but it's
right.
Nice for an outside organization to recognize ourselves. Something else that we've started to turn up a little bit is marketing. One of my goals for this year was tell our story more. Get ourselves out there, market our services, market our quality, market our outcomes. You're seeing more of that. This top award, you'll see some billboards throughout the community. T-shirts, everybody loves T-shirts. Those will be running around as well. We're not one to boast and brag, but I do think we need to tell our story, and this is a pretty fantastic story to tell.
Yeah, I know this just because I really do like the people I work with. I really enjoy coming to work. I just really enjoy working with people. And I know I work at a nice place, but one of the upsides of having agency staff or travelers is you get that reinforced, because I've had locum physicians here like, this is the best hospital I've ever worked at, from door to door. They're like, this is a really nice place to work.
Yeah.
And you don't, they're like, Dustin, you don't realize how fortunate you are compared to other places.
We've had same comments from travelers. Some of our travelers have a choice of where they go to.
Yeah.
It snowed this morning. Iowa may not be the most attractive location, but they've chose to stay here and re-sign with us multiple times because of our culture, because of the environment. And that's coming from a unbiased third party that's been to many different organizations.
Right. They don't have to give us a compliment.
Yeah, exactly.
They really don't have to. Well, since we have you here, what's on the horizon? What's on the horizon for St. Luke's Cedar Rapids?
Yeah, a couple different angles here. One, really excited about the momentum, what we have going on in our organization right now. We just got our engagement survey results back. Very strong results. Why is that important to me? As you just said, I feel if you're engaged in your work, you enjoy what you're doing, you're going to provide the best care. And you're going to choose to stay here in an organization and tell your friends and family about our organization. So engagement results were strong. That's great momentum heading into 2025. From a capital standpoint, expansion standpoint, we're growing, of course, continuing to grow. We do have high quality. We do have great outcomes. We need to make sure we improve our access and continue to meet the needs of the community. So when somebody needs a physical, a mammogram, whatever the case may be, we're able to get them in and shorten that wait time. So in doing so, we've expanded here recently. Everyone has likely heard about the Marion ED. Great additional access point up in Marion. Alternative to coming down here to St. Luke's. It meets the community where they're at. Marion's a growing community. Nice outcomes out there and strong early results. The cardiology expansion. So this one's wrapping up. Team members that may not be here at the hospital, or community members not here at the hospital. You drive by on 380 and you don't see this. There's a lot of work going on. The track up on third floor is now vascular labs. Again, our ability to meet the needs of the community, expand some of that access for vascular. Cath labs, EP, we added additional EP lab. And the last step is a hybrid OR, which will happen next year in our operating room. So a lot going on in cardiology. The demand for cardiology services are picking up. We've added additional physicians there. And then, the other is expansion into other markets. The corridor is a growing part of the state. We're blessed with that. Not every part of Iowa is growing like the corridor is. We're looking at other geographical areas, surrounding areas where we see population growth and we see those communities looking for additional access. So more to come on that next year and beyond. But we're actively looking at those strategic opportunities to make sure that the quality we provide is best available to our communities.
Well, Casey, thank you for joining me. Once again, this is Casey Greene, Market President of UnityPoint Health, Cedar Rapids. For more information on services offered at St. Luke's, the #1 hospital in the state of Iowa, right here in Cedar Rapids, visit unitypoint.org. Thank you for listening to LiveWell Talk On. If you enjoyed this episode, don't forget to subscribe. And if you want to spread the word, please give us a 5-star review and tell your family, friends, neighbors, strangers about our podcast. We're available on Apple Podcasts, Spotify, Pandora, or wherever you get your podcast. Until next time, be well.